Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
Boost your health today with Simply Nature Power Pack, a 5-day combo pack of Simply Nature PPARS for immune boosting and Simply Nature Cleansing Plus for effective detoxification. Experience this dynamic duo now. Available on Shopee, Lazada, and our website www.simplynature.asia and our office here in BGC. Grab yours today!
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. The main reason why I tried PPARS liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery. Or prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery, and after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. Diba? If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We're always with you from start to finish.
Good day everyone, I am Beth. And today, kasama ko po si Ma'am Mabs to tell her cancer journey. So, hello Ma'am, good day po. Kamusta po kayo Ma'am?
Okay naman. Ngayon okay ako. Malakas.
So Ma'am, can you tell me something po kung sino po ang isang Mabs?
Ako po si Ma'am. Nanayagnose po ako ng cancer noong November 2023. Ang simula talaga ng aking nararamdaman noon ay sa ipin lang. And then, ayun, nakita na may cyst na, may bukol na ako sa gum. Pagkatapos, required naman ako for MRI. Lumabas sa aking result na mayroon nga daw akong osteosarcoma. And then, na-confirm nung myopia ko na ito ay adenoid cystic carcinoma. Which is, rare daw yun, sabi nila. May possibility siya na umakyat sa pataas at kumalat pa sa pababa ang liig. Nag-undergo ako ng operation, which is tinanggal yung kalahati ng nalagal ako. Kaya ganito ako magsalita.
Paano po ninyo na-meet or nakilala si Dr. Jansen and yung Simply Nature PPARS? Kilala ko po si Dr. Jansen at na-meet ko po yung Simply PPARS. Dahil po nanonood ako sa Facebook, nung nag-tape na ako ng Simply PPARS, talagang malakas po katawan ko. Simulan sa po, hindi ako sinipon, hindi ako nilagnat. As in, malakas ako. Talagang maraming na-amaze sa akin. Pumayat ako sa treatment ko, pero nakikita nila na malakas ako. Kaya pati yung mga team na radiology, ang sabi sa akin na maganda daw yung malat ko, hindi daw nasunog. Dahil yun sa simplificar. Kasi yun ang katuwang ko. Ako yung nagpapa-radiation. Sa umaga, radiation ako. And then sa gabi, nagtitik ako ng PPAR. Dati, ang required sa akin ay chemo at radiation. Pero nung nakita na on ko na nag-stay lang yung at walang kumalat kahit sa parte na katawan ko, radiation na lang, na-required sa akin. Ayun, papasalamat talaga ako. At nakilala ko yung simplificar at Dr. Jansen. Malaking tulong talaga. Parang hindi ako nagpapagod. Kilos ako ng kilos, ako naglilinis, ako nagluluto, at namamalimpi pa ako mag-isa. Pero kilos pa rin ako ng kilos, parang bigla akong maisip na, may uuupin ako na, may ganito ako, gano'n. Dati kasi may osteoarthritis na alam ako. Pero mula nung nag-test din ako, nawala lahat yung nararamdaman ko. Malakas ako at maganda yung tulong ko. Talagang pahagising mo sa umaga, wala ka nararamdaman na, masakit yung ganito ko, ganyan, di ba yung kapag nagkakaedad na tayo, masakit yung tuhod, masakit. Ako asin wala parang fresh, parang bumata ang pakiramdam ko. At marami nagsabi, mas naging blooming lang ako ngayon. Dahil yan sa pagsisin ko na simplificar. Ako po, si Ma'am, nanayagnos ako na adenoid cystic carcinoma. After ko maoperahan, nag-take ako ng Simply Nature-inc at noon po ako lumakas. Napabilis ang aking paggaling. Kilos ako ng kilos. Nakakalimutan ko na may sakit pala ako o naoperahan ako. Kaya sa simplificar, lumakas ang katawan ko at napabilis yung paggaling ko. And I trust Simply Nature.
Hi everyone, these are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
Boost your health today with Simply Nature Power Pack, a 5-day combo pack of Simply Nature PPARS for immune boosting and Simply Nature Cleansing Plus for effective detoxification. Experience this dynamic duo now. Available on Shopee, Lazada, and our website www.simplynature.asia and our office here in BGC. Grab yours today!
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. No? The main reason why I tried PPARS liquid, and it did well for the patient. No? It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery. But prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar. And then undergo the surgery. And after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. Diba? If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We are always with you from start to healing.
a board-certified pharmacist, and one of your health advisors here in Simply Nature. So we are an international distributor of food supplements made from unique strain of microalgae called PPARS, which has been tried, tested, and certified to support not only for cancer treatment, but also for general wellness and metabolic syndromes such as diabetes, hypertension, and high cholesterol. So last week, Thursday, was for the majority of cancer patients who are undergoing chemotherapy with the oncologist. And moving forward tonight, we are here to explore the complexities of cervical cancer, the treatments available, and most importantly, how we can empower ourselves in this journey in this 179th webinar entitled Managing Cervical Cancer, Empowering Patients Through Treatment. And now, without further ado, let me call on our first expert, a seasoned international speaker on a wide range of topics from personal success to healthcare, who is also the founding director of Simply Nature International, our PPARS expert from Singapore. You all know him. It's Mr. Shyan Lim.
Hi, everyone. Tonight, we're going to talk about cervical cancer. And of course, we will have Dr. Jansen joining us in the Ask Me Anything segment. So I know Mary Jane Ramos, you've already asked a question. We will answer your question during the AMA segments, right? So we are already reading the questions that you guys are typing on your chat. So please type them in. We'll look forward to answering all your questions, all right? So I'll hand the time back to Jhen, who will introduce Dr. Jansen, our speaker for tonight.
Yes, thank you, sir. And next is an honor to present our second esteemed speaker, Dr. Jansen Kalalan, a distinguished graduate of St. Luke's College of Medicine, a diplomat of not only the Philippine College of Lifestyle Medicine, but also the International Board of Lifestyle Medicine. Currently serving as a consultant at renowned institutions, including Alta Integrative Medicine and Wellness Complex, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group. Dr. Kalalan specializes in the treatment of cancer and metabolic illnesses. Let's all watch this.
Hi, this is Doc Jansen, your lifestyle medicine doctor, helping you in your recovery from cancer. So today, ang pag-uusapan natin ay kung paano gumaling sa cervical cancer. So bago natin sagutin ang tanong na yan, ano nga ba muna ang cervical cancer? So ang cervical cancer ay tumor. Ang cause ng cervical cancer ay ang tinatawag nating human papilloma virus or HPV virus. So itong HPV virus, saan ba ito nakukuha? Nakukuha ito sa pagtatalik, especially for those na maraming sexual partners. So gaano ba ka-common ng cervical cancer sa Pilipinas? Actually, it is the second most diagnosed cancer among women. So noong 2020, merong 7,900 women na diagnosed with cervical cancer. Also, cervical cancer is ranked 4th in the number of deaths due to cancer among Filipinos. So kapag na-diagnose ka ng cervical cancer, mabubuhay ka ba? Ano ang survival rates ng cervical cancer? So the 5-year relative survival rates for cervical cancer for localized stage is 92%. For regional, 58%. For distant or metastatic, it's 18%. So makikita natin dito sa survival rates na to is kapag na-detect ang cervical cancer very early on at nagamot ito, malaki ang chance na mabuhay ka after 5 years. However, kapag napabayaan natin ito at hindi tayo nakapagpagamot agad, bumabagsak to 18% na lang ang survival after 5 years. So, paano ba ginagamot ang cervical cancer? So, ang treatment options na available sa'yo ay nakadepende kung ano ang stage ng cancer mo nang ma-diagnose ka. So, we have 4 stages of cervical cancer, which is stage 1 up until 4. Stage 1 is a tumor confined to the cervix. Stage 2 is a tumor that extends beyond the uterus but has not extended onto the lower third of the vagina or to the pelvic wall. Stage 3 is a tumor involving the lower third of the vagina and/or a tumor that extends to the pelvic wall that causes hydronephrosis or yung pagbabalo ng kidney or a non-functioning kidney and/or lymph nodes that is found inside the abdomen. And lastly, stage 4. This is a tumor that extends beyond the true pelvis, involves the bladder or rectum o ito yung urinary bladder o ang pantog o yung huling bahagi ng colon. And lastly, that is spreading to the distant organs katulad ng liver, lungs, bones, brain. For every stage of cervical cancer, mahahati pa ito further into stage 1A, stage 2A, stage 2A, stage 3B, etc. So for stage 1A1 cervical cancer, ano ang treatment options na available? That would be cold knife conization. This is a fertility sparing procedure, no? So for patients who are diagnosed with cervical cancer na gusto pang mabuntis, this is the way to go, especially for early stage cervical cancer. For high-risk patients naman na na-diagnose early, no, with cervical cancer, you can actually opt for total abdominal hysterectomy with or without bilateral salpingo-oophorectomy. In other words, yung uterus pwedeng tanggalin at optional na tanggalin ang ovaries at ang fallopian tubes. So for stage 1A2, you can have your entire uterus removed together with the surrounding lymph nodes. However, kapag ang isang babae ay gusto pang mabuntis, you can opt for radical trachelectomy. So ano ba itong radical trachelectomy? So itong radical trachelectomy is removing half of the uterus or the lower half of the uterus and then attaching the rest of the cervix together with the upper part of the uterus. And lastly, you can opt for brachytherapy or internal radiation therapy. For stage 1B and stage 2A cervical cancer, you can actually have 4 options. So number 1 would be concurrent chemotherapy and radiation therapy. So ibig sabihin sabay po na ibibigay ang chemotherapy at radiation therapy para mas maging effective ang radiation therapy. Next, pwedeng radiation therapy lang. Number 3, you can actually opt for surgery, chemotherapy, with or without radiation therapy. And lastly, para dun sa mga babae na gusto pang mabuntis, you can actually opt for radical trachelectomy. For stage 2B, 3, and 4A cervical cancer, you actually have 2 options. So number 1 is concurrent chemo radiation therapy, same as before, no? And number 2, surgery to remove pelvic lymph nodes plus radiation therapy with or without chemotherapy. And number 3, targeted therapy using bevacizumab or a combination of these procedures and medications. Doc, paano naman kung tapos na ako sa treatment at later on nagkaroon ako ng recurrence? Ano naman po ang mga treatment options na pwede kong gawin? So for cervical cancer recurrence, you actually have 4 options. So number 1 is immunotherapy using pembrolizumab. Number 2, concurrent chemo radiation therapy again. Number 3, chemotherapy with targeted therapy. So ito po yung chemotherapy na cisplatin, carboplatin together with bevacizumab. And number 4, pelvic exenteration. So ano ba tong pelvic exenteration? So ang pelvic exenteration ay reserved only for patients who cannot undergo radiation therapy. At ang procedure nito ay ginagawa para tanggalin lahat ng parte ng katawan na mayroong cervical cancer. So Dok, paano yan? Mukhang ang daming side effects ng mga treatment na to, no? Especially chemotherapy, radiation therapy, ang daming side effects nito, and one of them, ang very common side effect is weakening the immune system, fatigue, no? So may mga paraan ba tayo na pwedeng gawin para ma-avoid natin ito at mabawasan ang mga side effects nito? Yes, there is, no? So one method is to exercise, no? So physical activity is actually very important kasi patients engaging in more physical activity reported better physical, functional, general quality of life, less fatigue, fewer physical cancer-related symptoms, and less general distress. Also, no, in terms of the mood and emotions, no, fewer patients actually reported depressed mood with more physical activity. Actually, the more physically active you are, the less fatigue symptoms you will feel. And this is especially true para doon sa mga pasyente na nag-undergo ng treatment. So, for patients who are undergoing or who are about to undergo cervical cancer treatment, no, especially chemotherapy, radiation therapy, very important ngayon pa lang dapat mag-exercise na kayo so that once you are already undergoing the treatment, mas less ang side effects. So, Dok, paano naman yung immune system namin? Will exercise still be able to help our immune system? Yes, no, actually moderate intensity physical activity like brisk walking, cycling, swimming can make your immune system much stronger. However, ang problem dito is kapag you are undergoing chemotherapy and radiation therapy at dumating sa point na na-damage yung bone marrow, mahirapang makarecover ang immune system. So, may mga paraan ba paano natin mapoprotektahan ng bone marrow natin? Yes, there are, no? So, number 1, make sure that you are eating a high-fiber diet. So, lots of fruits, vegetables, whole grains, and legumes. And may mga supplements ba na pwedeng makatulong? Yes, like Simply Nature PPARS. Actually, may study na ginawa dito, no, ang Simply Nature at ang ginamit nilang chemotherapy drug, no, is cisplatin. So actually here in this study, they investigated the health of the bone marrow, no, upon giving cisplatin, no. So we have the control over here. So makikita ninyo dito sa control, yung integrity or yung itsura or yung architecture ng bone marrow is still very much intact. So this is a healthy looking bone marrow. However, kapag binigay yung cisplatin, nasisira yung architecture ng bone marrow. So this is actually the main reason why the white blood cells, yung red blood cells and the platelets go down when patients undergo chemotherapy and radiation therapy. However, kapag kinumbine ang microalgae, ang Simply Nature PPARS together with cisplatin, makikita ninyo na preserve pa ang health ng bone marrow. So actually, this is one product that you can consider when you are about to undergo chemotherapy or radiation therapy, no? And lastly, ang pinaka-important dito is to eat a healthy diet, especially a high-fiber diet. Okay? So ano ang benefit ng high-fiber diet when it comes to treatment or surviving cervical cancer? Number one, a high-fiber diet would be able to give lots of prebiotics to your probiotics. Okay, so ang probiotics is your gut microbiome. Ito yung gut bacteria that is residing inside your colon. Now, eating a high-fiber diet will give your gut microbiome lots of prebiotics. Kapag nag-interact ang prebiotics at ang probiotics natin, short-chain fatty acids are produced, which is called butyrate. At so itong butyrate na to, actually very important ito pagdating sa immune system. Kasi ang butyrate is not just an anti-cancer nutrient, no? It also makes our immune system stronger. So actually, one evidence, no, how this works, no, is they investigated this high-fiber diet together with immunotherapy on melanoma patients. And they found out that melanoma patients with a high-fiber diet or eating a high-fiber diet were 5 times more likely to respond to immunotherapy like pembrolizumab compared to those with low-fiber diet. So that's it for our webinar. For more cancer care tips, ask Doc Jansen. We are now open for your questions.
Have it. Empowerment is about taking control of your health and making informed decisions. It's about having open and honest conversations with your whole healthcare team, understanding your treatment options and knowing your rights as a patient. And I'm sure this raised a lot of questions. So kindly ask away in the comment section now. Kahit Tagalog, okay lang po, because now is your chance to get the information you need to feel empowered. With the help of our experts, let's call on again Mr. Shyan Lim and Dr. Jansen Calalan.
Hi, Jhen. Hi, Doc. Yeah, I haven't haven't got a chance to talk to you since Saturday.
Saturday, yes.
Yeah,
But I have to
So,
catch up soon. Yeah.
yes, we have to. Okay, Doc. Yeah. Just for our audience, I just recently celebrated my 50th birthday. So one of the one of the benefits of PPA protocol is anti-aging. All right. Okay. Jen, before we begin, I think I like since who is this? Mary Jane asked the question so early. I like to start our AMA with her.
Okay.
So she asked, right, may I know what are the possible side effects of PPAR powder without chemo radiation? So I just want to say that there are no side effects of PPAR powders, right? But there are side benefits. Because for your case, I'm sure since you have cervical cancer, you are taking it for cancer. However, you're gonna see other benefits such as your metabolic syndrome. So your blood sugar, blood cholesterol, all these are going to improve. So will chronic inflammation, energy levels, and a whole host of other. For your prep, are you going for chemo? Let me see. Stage 3. So, Doc, for a stage 3 cervical cancer, she will most likely be prescribed chemo, right?
Stage 3, yes. Most likely chemo is needed for this kind of cancer. If it's not chemotherapy, then it has to be a systemic treatment, something that, targets the whole body to eradicate the cancer cells.
So if because these are your options, PPAR powder is going to prepare yourself, and if you and it's also going to be a natural immunotherapy as well, right? So in effect, so it's going to be it's going to help you. Yeah.
Thank you so much for starting off our AMA or Ask Me Anything portion. Okay, next question. This was unanswered from the last webinar. Okay,
All right.
from Miss Relda Gilda. If I'm undergoing chemotherapy for breast cancer and also found out that the thyroid has thyroid 5 findings. So does the chemotherapy also go to the thyroid? For
Yes, it will. It will. It will. However, the question there would be, will the thyroid nodules, the thyroid masses, will it respond to the chemo? Because for thyroid, no, for thyroid masses, especially thyroid cancer, we don't really use chemotherapy for that. We use radioactive iodine for that. Okay. Yeah. So more often than not, if you were given chemotherapy, the thyroid masses did not shrink in size, it did not respond, then you would have to undergo another set of treatment, which is radioactive iodine. If the thyroid nodules are small enough, no, the thyroid can be they can be surgically removed, which would be better. Yeah.
Okay. Oh.
Mm.
And the next question from Jen Chan Ang. Can PPARS tablets cure hemolytic anemia? Thank you.
Okay. Hemolytic anemia, let me explain what this is. All right.
Yeah.
Anemia is low hemoglobin. So why is the hemoglobin low? Well, red blood cell counts might be low, or you might have iron deficiency, some sort of nutritional deficiency. Okay. Hemolytic anemia is a situation, it's actually a complication, no, of something else. Hemolytic anemia is when your red blood cells are exploding, they burst.
Wow.
Yeah, they get destroyed.
Wow.
Yeah. So red blood cells are cells. If there's some external cause, no, that causes it to burst, then that's hemolytic anemia. So PPARS tablets cure hemolytic anemia. I won't say 100% yes, because it depends on what the reason is. Okay, so I'll give you one example.
Yes.
Yeah, I'll give you one example. No? Say for example, we are giving high dose IV vitamin C. And by chance, if you are G6PD deficient, this enzyme, you are deficient of this enzyme, then hemolytic anemia can happen. Okay? Because why? It's because your body cannot process the amount of vitamin C that is being given. Okay? So in other situations, when the IV drip is too osmolar, the osmolar, how can I simplify this term? It's too salty. Okay?
Okay.
It's too salty. All right? Then hemolytic anemia can happen. Okay, same thing if the IV drip that is being given is hypotonic, no, meaning it's too malabnaw in Tagalog. I don't know what that in English is, but if so, then the excess water can go inside the red blood cells and cause bursts. It can explode basically. Okay, so these are iatrogenic causes, so meaning something medically done to a patient that leads to hemolytic anemia. For diseases itself, especially if you have problems with your liver, if you have problem with your the red blood cells themselves, no, it can lead to hemolytic anemia as well. Okay, so it really it really depends on what the reason is, no, whether PPARS can cure it or not, no. So it really depends.
Right. So there you have it. So on the positive side, it's something that you can try because there are other benefits to the PPAR protocols apart from your anemia. And if you really want to have a consult with Dr. Jansen so he can really ask you the right questions so that you can get the appropriate treatment for your condition. Jen?
Okay, next question. Oh, okay. A follow-up from Miss Mary Jane Ramos. She commented,
Wow.
my treatment will be 25 to 30 radiation with 6 cycles of chemo and 4 brachytherapy. And as of now, I'm taking PPARS powder for almost 2 months.
Yeah,
Doc, maybe you start first and then you add. I will shift to you.
Sure.
Mary Jane, I think number one, being on 2 months on PPARS is really great. You have prepped your body. You would have to continue on your PPARS powder as you go onto your chemotherapy and radiation therapy because it will help you recover. Now, in the event that in the midst of your chemotherapy or your radiation therapy, if you feel terrible because of the effects of your treatment, then I would suggest getting a box of liquid, right, to be taken when you feel your worst, right? So that will boost and help you get back into your to positive condition so that you can go through your treatments. And don't forget, every time you take our PPAR extracts, do take the tablets. All right, they're going to be the basic nutrition covering a wide range of nutritional needs that you may have. Okay, Doc, what do you think about she's on powder now and she's going for these treatments? Would you recommend, like what I suggested, to take liquid if the treatments is giving her, she's having difficulty with the treatments? Yeah.
Yep, absolutely. Okay, let me give you some other perspectives. No, I have a patient who's taking oral chemotherapy. So capecitabine. Capecitabine is known to have a lot of side effects.
Wow.
Various side effects. You can lose your hair, you can vomit, diarrhea, constipation, numbness. Then your nails can become brittle. The fingers can darken. Basically a lot of side effects, no?
Yeah.
This patient of mine did not experience any of these.
Oh.
Okay, here's the thing. I guess with this information, it really depends on the patient's body.
And
so
health.
yeah, so for Miss Mary Jane Ramos, if of course you're undergoing all these treatments, no, then ask yourself, do you experience any of the side effects that your onco told you about the radiation, about the chemotherapy? If you are experiencing these, then probably you need a higher dose of PPARS. So liquid in that sense would make sense. Okay, but if you're okay, side effects are tolerable, your doctors are happy with your lab results with PPARS powder, then PPARS powder is fine.
Yep.
So it really depends. There's no hard and fast rule here. So it really depends on how the patient reacts, no, in this regard. Because yeah, I was also quite surprised just with the tablets.
Yes, very surprised. Yeah, but you know, some patients, they just react so well, right? And it could be other factors in their life that work together with the tablets. Yeah.
And mind you, this patient of mine did not lose a single strand of hair.
Wow.
Oral chemo. No.
Wonderful.
Yeah.
Right?
Her hair was really thick. I just talked to her a while ago. Earlier this day.
Okay, so I hope that's encouraging for everyone else that's watching the program right now, right? You hear from 2 weeks ago, is the RGCC test where they test for the circulating cancer tumors within your blood. So your answer to your own question is actually correct. If there's a recurrence, it means that the cancer cells have already spread. They've already gone into your bloodstream prior to your full hysterectomy, and they are circulating in your system. It's just that it's too small for it to turn up on any markers, right? Except for maybe like what Dr. Jansen suggests, the DNA test, right? Where they test for the cancer DNA in your bloodstream. So this is so you've answered your own question, right? The answer is yes. And this is where getting support when you're going through your chemotherapy, your hysterectomy, and all other cancer protocols, you got to have the correct supporting protocol so that you lower your chances of recurrence. All right, yeah. Doc, do you have anything to add to that? And then
Can you read the full question before the
right.
ads? Okay. So
Yeah.
from Facebook, from Louis de la Cruz, how will recurrence occur if one has undergone total hysterectomy? Does it mean it has spread to other body parts?
Yeah. So this is a very good question, okay?
Hmm.
So for tumors, no, cancer, surgery is the only procedure that we can claim that it is curative of cancer because we totally remove the tumor, excise it. However, since this is cancer and cancer forms its own blood supply, no? So little bits of cancer cells can slough off, separate from the main tumor. It can circulate around your body. It can spread to the nearby organs, nearby tissues. No? So, even if it hasn't turned up on any imaging studies, this is a possibility already. Okay? This is a possibility already. All right? And how can we know if your risk for such thing is high? It's through the circulating tumor cells test, circulating tumor DNA, circulating tumor cells test. Okay? Now, how if during the surgery, so while removing the tissue, this is also one possibility. There is some manipulation that is being done, so the tumor cells will be disturbed, no? So they can separate from the main tumor and attach to the nearby tissues and organs. Although the tenet of removing any tumors is en bloc, no? En bloc meaning remove it without disturbing the main tumor or touching the main tumor. So they remove it by allowing significant margin from the border of the tumor. So say for example, you have a 2 centimeter mass, no? They allow for a 1 to 2 centimeter margin away from the border of the tumor. That's how they cut it off. Okay, so why do they do that? The reason is for to minimize recurrence. Okay, so they remove it in block. So to minimize the disturbance of the tumors. However, even if we do that, there is still this risk of the cancer recurring. Okay, because these are microscopic cells, no? So with little amounts of manipulation, little amounts of just by touching it, irrigating it during the surgery, small bits and pieces of cancer cells can separate. So that's why we don't just rely on surgery, getting it removed. Aside from surgery, we have to use other treatment modalities to lower the risk of recurrence. So that is where your supplements, the chemotherapy, the radiation therapy, all the other things that the onco is prescribing you with, all the supplements that I am prescribing you with, no? That's where those things come in. Okay? So yeah, no, and to answer the second question, if you have underwent total hysterectomy, no, the tumor was removed, no, on scan you are clear of cancer, no, according to imaging. Then sometime later on in the future there is this recurrence, then yes, we can say that it has spread to other body parts. Okay? So that's why if such a thing happens, no, especially if the recurrence occurred distant to the area of the tumor, then we usually say that it is already metastatic, a metastatic recurrence, no? So that's stage 4 automatically. All right?
All right. Before we go to our next question, I just want to greet our avid viewers, Miss Elena Robles Antonio and Naomi Alona Veras. Welcome to the program po. Okay, next question again coming from...
Sorry, Jhen, I want to follow up because I think these are all related questions. There is a Miss Ciela Estenon, I think.
Okay.
Let me read her question. I'm already taking PPARS powder before my surgery and after my surgery, almost 1 month of using it. now I will be having my chemo by October. When do I stop, or do I and continue to take it? Will it have a side effect while I'm having my chemo? So this is directly related to what Dr. Jansen has said, right? You already have your surgery. How come after the surgery, after the tumor is removed, you need to go for chemo? Dr. Jansen just answered that process because they are microscopic cancer cells. They have spread but cannot be detected. That's what the chemotherapy is for. Now, I just want to let you know, you don't stop your PPAR powder, you continue, because the PPAR protocol will protect your bone marrow and your spleen from chemotherapy damage, which is very important. And this is going to link to the recurrence, right? Because when you're doing chemotherapy, your chemotherapy kills the cancer cells, but it also hurts your own body's immune system. Specifically, it damages your bone marrow cells, which is where your blood cells, both red and white, are produced. And that's red and white blood cells are very critical components of the body's whole immune system, which comprises of other parts as well, right? Other components. So you want to protect your bone marrow during your chemotherapy, and it will also keep your energy up. And like Dr. Jansen said, right, even for his best patient, even the tablets help her keep her hair. She didn't lose. So if you take the powder, keep on the powder, that would be the best option. However, I do understand one thing. If for any audience that's listening, if at any moment the financial aspect of your cancer treatment becomes very challenging. For example, it's your third month and all the bills are adding up. Don't just stop, right? Drop a note, give a call, drop a message to our Facebook page, right? You can have a consult with Dr. Jansen or ask Jhen. They will be able to advise you on what other protocols to go to. For example, you can go down from powder to soft gel capsules, right? And in Dr. Jansen's just shared, in the most best of cases, even the tablets has fantastic results. All right, so it will help you during your chemo, so don't stop. All right, yeah, that's it. Okay, Jhen, your question.
Okay, yeah, she has other questions. So from Miss Rochelle Esternan also, what foods to avoid for a cancer patient?
Yeah, Doc, this is Doc's expert.
Yeah, she enumerated some. How about fishy foods like chicken, egg, crab, squid,
Oh,
Okay.
crab, no. Oh,
and
no.
fish sauce?
Okay,
Fish
here's the
sauce,
thing.
no.
The default diet for a cancer patient is a vegetarian diet. That's the default diet, okay? Whole food, plant-based. However, I do understand that people love to eat, no? Especially if you're a foodie, Miss Rochelle, okay? So, if we try to negotiate, no, if you are going to eat animal food products, and by the way, no, animal protein stimulates tumor growth. It's just the way it is. Me personally, I wish it was not the case, but unfortunately, science says so.
Yeah, there's a lot of research over the years that prove this. All right, and Dr. Jansen, I remember you shared even beef, all red meats are actually classified as class 1 carcinogens. That means these are
Class 2. Class 2 carcinogens. They're probably carcinogenic. Yeah, but it's still high. It's still high. Eating red meat increases risk for colorectal cancer. So it's still high.
Still high.
Yeah. So here's the thing, no. So rule of thumb is you have to go on a plant-based diet. All plants, no. Don't eat processed foods like processed carbohydrates. No, processed carbohydrates would be your potato chips, your French fries, your sweets, pastries. So I think you get what I mean, no? You understand what these foods are. For the animal food products, say for example, you want to negotiate. I'm very sick of a vegetarian diet already. I want to eat something different. So if you are going to eat any animal food product, which of these food items would be the least evil of them all? That would be fishes. But the fishes would have to be unfarmed, or a fish that is not farmed. Okay? So Do not eat farmed fishes because these fishes are very toxic. Examples would be your bangus, tilapia, galunggong, dory, creamy dory. Okay, so those are the examples of the farmed fishes. Sardines are okay as long as they're not canned. Salmon, tuna are okay. However, here's the thing with fishes. Our oceans and seas nowadays are very toxic already because why? We dump chemicals onto the sea. So these fishes will accumulate the heavy metals that our industries are um, dumping into the ocean. So if you eat fish, okay, you have to constantly detox. So that's where PPARS comes in as well because microalgae are very good chelators of heavy metals. Aside from PPARS, I also give other detox, but it will already depend on the case of the patient. But basic is PPARS. Okay. Yeah. So aside from the fish, all other animal food products can increase your risk of recurrence, risk of tumor growth significantly, especially dairy. There's a protein found in dairy which is called casein. I believe that's spelled as CASEIN, which stimulates tumor growth. So if you will avoid something, one food, no, that would be dairy. So dairy will include your cow's milk, animal milk in general, followed by your cheese products, margarine, butter, yeah, these food items. Okay, so yeah.
Doc, I wanted to ask a question. I have I have a friend who was diagnosed with stage 2 breast cancer, borderline third stage. Then they went for a breast surgery. So what they decided to do was minimal. That means they didn't do a mastectomy. What's your advice when it comes to breast cancer when the tumor is operable? Do you suggest a full mastectomy, partial? Yeah. What's your take on this one? In general,
Well,
of course, I know every case is different. You really have to look at the case. So all the viewers out there, this is just a guide, but this is so important. Have a proper consult with Dr. Jansen. All right? Yeah.
Yeah. Okay, so just a disclaimer, I'm not a surgeon. The best guy to answer this question is really Dr. Jamie Katapia.
Yeah.
However, with the articles that I have read, no, the better procedure to do is breast conservation surgery. Breast conserving surgery. So instead of removing the entire breast, we only remove the lump itself. It's a lumpectomy. Then add in radiation therapy. The chances of recurrence for such a procedure is better than mastectomy.
Oh, I'm
Yes.
surprised. I'm surprised. All right.
Yes, yes. So, however, of course, you would have to be assessed by a surgical oncologist, no, to properly classify you if you are fit for this kind of surgery. Okay, so I have to. Dr. Jimmy has to be on this show as well.
Yes, yes. Dr. Jimmy is the expert on this one.
Yeah.
All right.
All
But
right.
Jen, I think I saw a breast cancer question, right? From Zen Diaz. Yeah. Maybe you can highlight.
Okay, from Shanshan Diaz. Okay. She says, I have a stage 4 breast cancer and taking palbociclib. It's a targeted therapy. So can the capsule and tablets be able to help me?
Yeah, absolutely. Absolutely. I have patients who are on palbociclib. By the way, palbociclib can also decrease white blood cell count, similar to chemotherapy. The good thing there is PPARs can be taken in tandem with palbociclib, and they work quite well. Okay, so of course you will be on palbociclib. White blood cell counts will go down. However, since you are on PPARs, even if the white blood cells are, quite low, they would still work well. Okay, because it would be similar to white blood cells, although they are few in number, but you have good quality white blood cells.
That's very good news. Another related question from Mr. Emer Emboscado. How long before we can see the effect of PPARS for breast cancer?
Really depends on the stage and what other treatments you are undergoing and what other supplements or medications that we use PPARS with. Usually the effect can be immediate, as fast as 1 week. It also depends at what kind of effect we are looking into. If you are only taking PPARS alone and we want to see if the outcome that we want to see or measure is the breast cancer shrinking, it can take quite some time. I have to be honest here. Okay. One patient that I have presented who used PPARS alone for her tumors, which I presented a few months back, June, I believe. 12 centimeter tumor disappeared completely in 2 years time of taking PPARS liquid. Okay, so
And that one
yeah,
is, Doc, just to clarify, that one was actually a case where even her oncologist didn't know what to do anymore.
yeah,
Right?
correct.
The chances of the tumors disappearing was like, from conventional medicine, it was like impossible. I wouldn't say impossible, but just, yeah, difficult, very, very difficult. But it happened.
Difficult. Yeah. Personally, being her physician, I was not expecting the tumor to disappear, but with the scans that we saw,
Yeah.
yeah, it was gone. It was gone.
Yeah,
It
it
was
was
gone.
gone.
Really, it was. I was really I
Wonderful.
was also surprised myself.
Yeah, it was very encouraging.
Oh. Okay, next question from Lagrosmi Teros Valles. Can I still continue taking PPARS powder while on chemo procedures? What is the best time taking on or before the procedure of chemo?
Yeah, very good question. This is also one of the questions that frequently asked, no?
Yes.
Yeah.
So it depends on the chemotherapeutic drug. There are chemotherapeutic drugs that we can combine together with PPAR. So meaning you take them at the same time on the same day. So one such chemotherapy drug is your capecitabine or Celoda. Other chemotherapeutic or other chemo drugs, no, usually my rule of thumb is I don't give them together on the same day. I usually allow at least 24 hours after the chemotherapy before you continue on with the PPAR. So why do I do that? It's not because there will be drug supplement interactions or there will be something bad that will happen to you. The reason why I space them out is that I want the patient to get the full benefit of the PPARs because PPARs are very strong antioxidants. Chemotherapy are very strong oxidative agents. So if you take PPARs, then receive the chemotherapy, the antioxidants of the PPARs will be eradicated. Okay? It will destroy the PPARs. The chemotherapy will destroy the PPARs. So I space them out, and if ever there are complications that arises, the oncologist cannot blame the PPARs. Okay, because you're not taking the PPARs on the same day as the chemotherapy. Okay, we allow 24 hours after, no? So it's a rule of thumb that I learned from the Philippine Society of Orthomolecular Medicine. So it's also the same with other supplements that they're using. So typically, what I advise patients, no antioxidant supplements on the day of the chemo. Antioxidant supplements should be taken 24 hours after receiving the chemotherapy. There are, however, vitamins and medications that that would be best taken on the same day as the chemo. Okay, so one such example would be vitamin D3. Vitamin D3, yeah. So it can be taken, no, on the same day as the chemo. Other supplements like mebendazole and ivermectin, these can be also taken on the same day as the chemotherapy. Okay. However, again, as much as possible, I space them out so that the detoxing system of the body will not be overly saturated or overly stressed, no? Because chemotherapy is already quite toxic.
Okay. So before we go to our next question, I just want to greet more of our avid viewers, Miss Celia Bongavilla and Mab Sagot. Okay, and then cervical cancer related question coming from Miss Cherry. She's a civil engineer from Bulacan, and she got HPV positive for a certain number, 31, 33, 35, up to 68. So what could have been the possible risk factors?
HPV infection, okay, I haven't talked to you. So this information we just get from our lessons from medical school, research articles, okay? So the most common reason of acquiring HPV infection is through sexual contact. Okay? Sexual contact, so it can be through, having multiple sexual partners, having sexual intercourse at a very early age. Another one would be instrumentation. I hope you understand what I mean by instrumentation. Okay. If not, go to Dr. Google. Yeah. Okay. So yeah. These are the reasons, no, why we acquire HPV infection. And with having an HPV DNA positive test, it doesn't mean that you'll get cervical cancer immediately. It's just that you have HPV. No, the HPV virus is present inside your body. Your body will be able to fight off the infection. It will be able to fight off the virus. Okay. However, the question there is, would your immune system be enough to combat the virus? Because let's face it, the reason why you underwent or why we are undergoing screening using HPV DNA test is to screen for it's to basically screen for cervical cancer, possibility of acquiring cervical cancer. Okay, that's the main reason, no? So with this, it's not yet 100% a diagnosis that you have cervical cancer. However, your risk is higher than the general population because you have HPV infection. Okay, so my suggestion there is make sure your immune system is strong. How do you do that? Make sure you are eating right, you're exercising, you're sleeping well. You have to take the right supplements in boosting your immune system. You have to detox your body, okay? Because inflammation is one of the triggers for a normal cervical tissue transforming into cervical cancer. Okay, inflammation, no? So there are a lot of supplements that you can use for that. So one would be Simply Nature PPARS, of course, no? Other supplements would be any supplements that has mushrooms, vitamin C, your vitamin D3, your melatonin, omega-3s. Well, PPARS already has omega-3s. So these are some. Okay.
Okay, thank you so much, Doc. Another question from Miss Mary Jane. She's a teacher from Zambales diagnosed with cervical cancer stage 3B. Okay, her question is, what foods are allowed to eat if you have a cervical cancer? Like more
Okay, we go back
encouraged to eat. More
encouraged to eat, no? So all plant foods basically are okay. But if we are going to enumerate a few foods, no, that would be good for cancer in general, not just cervical cancer, that would be your cruciferous vegetables, so broccoli, cauliflower, your cabbage, especially purple cabbage, your garlic, your onions, no, allium vegetables, your green leafy vegetables, mushrooms in general, beans as well, beans such as garbanzos, lentils, your split peas, no? These are very strong. These foods have very strong anti-cancer properties. They improve the immune system quite well. For fruits, that would be berries. Berries such as blueberries, raspberries, and any kind of berry that you can find locally are also okay. No, strawberries, no, one such example. lemon, as well, citrus fruits in general. However, for the citrus fruits, you have to include the zest, okay? The zest, no? Yung grate, the grate of the skin of the citrus fruits. You have to include that in your food, no? Especially you wash them well, no? For whole grains, you can go for red rice or black rice. Those are the whole grains that have quite good anti-cancer properties. What else I not mentioned? I think I've already mentioned a few. Peanuts. For peanuts, that would be walnuts, pecans, almonds, and peanuts. Okay, so that would be nuts, no? Nuts that have good anti-cancer properties. For your seeds, that would be ground flax seeds. Yeah, then all the spices that you can find. For spices, the more important ones that you have to take are your turmeric. For beverages, turmeric tea, of course, and your green tea. Yeah. So I've mentioned a lot. If you do just consume these foods, no, it would be already a big help. However, don't just focus on the foods that I have mentioned. You may eat foods outside of the things that I have mentioned, no, to make it more interesting, to make your food more interesting. Okay.
Okay. Okay, going back, a question from one of our webinar registrants is, which PPARS form is best for osteoarthritis and hypertension?
Just the tablets. Tablets would be enough.
Is enough.
Yeah.
Wow.
Hypertension, tablets would be enough.
Yeah.
However, again, what is the reason of the hypertension? We have to find out.
Mm.
Because if for more severe kinds of hypertension, then we
Yeah.
have to add the soft gel. Then,
Yeah.
that's it. For osteoarthritis, inflammation, so that's there's an ongoing inflammation there. We have to add the soft gel. Then we have to do other procedures to help regenerate the osteoarthritis. Is it the knee?
She
Did
didn't
he
say.
mention knee? She didn't say. As to
Yeah.
osteoarthritis lang.
Just
Okay. So for osteoarthritis, some procedures that we can do is prolozone. So prolozone is a mixture of ozone therapy and prolotherapy. Prolotherapy is basically injecting the joint of a mixture of nutrients and regenerative factors. Okay,
It sounds
that would
painful,
help.
Doc.
Prolotherapy, but it will help regenerate the joint, the damaged joint, no? Then afterwards, we inject ozone gas inside the joint or around the joint to help manage pain and to help oxygenate the area. So this mixture will help regenerate the joint. Okay. However, of course, there's a limitation if the osteoarthritis is already grade 4, meaning it's already fused, no? Then it's gonna be very difficult, no, with prolotherapy. The best treatment for grade 4 osteoarthritis is total knee replacement.
Wow.
Or replace the joint, no? So especially for knee osteoarthritis. For other joints, yeah, it depends on what joint it is. So that's one. Another procedure that would be good, especially for pain management, is acupuncture. Really, really good.
Yeah, really good.
Yeah.
Okay. You endorse it like you experienced it already. Like really. Okay.
No, have you ever experienced ozonization? Have you used ozone therapy on yourself?
Yes, I have. I was the guinea pig in our workshop.
How did
So I have
how did it feel? I mean, for a healthy person like you, what happens? How does it?
I initially felt a little bit lightheaded and
Okay, that's very oxygenated, right?
very oxygenated, no? And
Yeah.
how should I say, everything seems so bright after the procedure.
Okay.
Yeah, so I think eyesight somehow improved as well. But
Wow.
yeah, basically what happens, what they did to me is major autohemotherapy. So they got blood from me, around 200 ml of blood. They oxygenated, then they ozonated my blood and then administered it back to me. So that's the procedure I underwent. No untoward side effect, untoward adverse effect.
Mm.
At night I sleep soundly. So I guess
Okay.
it's because I'm relatively healthy. That's why the effects that I got were quite um unnoticeable, I should say. But for patients who are deceased or with diseases that are quite severe,
Mm.
it's like magic. I tell you, it's like magic. Um, I'll give you an example. Elderlies, no, one of my ninongs, although this ninong of mine is quite healthy, relatively healthy, no, but he's already a senior citizen. Yeah, he's already senior. This ninong of mine plays golf. Um, he hits around 180 yards, no, maximum. After we administered ozone therapy to him, with 2 sessions, he was able to increase his distance up to 200 yards. After giving him around 5, 6 sessions of ozone therapy, he was able to hit maximum of 230 yards.
Wow.
230 is a distance that is very difficult to hit when you are for senior citizens. 230 yards is the range of people in their 30s.
Wow.
So his friends were surprised.
That's
That's for
that's
a senior citizen. Yeah.
that's really interesting. Makes me curious about it. So for those of you who cannot avail ozone therapy because you need to be physically there, I just want to share with you, you can also achieve similar results with PPAR tablets and soft gel capsules, especially if you are diabetic or you're pre-diabetic or near diabetic, all right? Because many diabetic and metabolic syndrome patients feel tired easily, right? That's got to do with your metabolism. So if you go on PPAR tablets, one of the most common benefits that people will share is energy level really goes up. And if you are actually planning to go to the gym, it actually improves your stamina quite a bit. All right. So and also with the recovery. So if you can't avail ozone therapy in person, go for the next best thing. You can call Lazada and then you can have PPAR tablets delivered to your home. So try it. Jhen, I think there are more questions about mastectomy and recurrence.
Oh.
Yeah.
Okay, yeah. Let's
We
read.
last few before we end the night. Yeah.
Okay, from my Mashon. Good
Yeah.
evening. Can I ask question? Okay. I have invasive ductal carcinoma, result of my biopsy on May 30, 2024. But last week, one of my doctor requested another biopsy and the result is benign. So can I use your product?
Yes, you can.
Yes.
But you are diagnosed with cancer. You are. So even if you have two results, one being malignant, one being benign, I would follow the one that is malignant. Okay, so which is the first biopsy. Yes, you can use Simply Nature PPARS. Actually, it should be part of your protocol. The role of PPARS for cancer patients is to reduce inflammation, to improve immune system, to activate genes for longevity, to activate genes to boost your immune system. That's the role. Okay. For extracts, no, the role of the extracts would be to induce cancer cell death. All right. However, it doesn't end there. You need other supplements and medications, no, to completely halt the division of the cancer and to help stop its spread. Okay. Why is it so? Because there are 9 hallmarks of cancer. PPARS addresses a few of them, not all. That's why PPARS cannot be used alone, no? For cancer, no, to address cancer. There has to be other things that we have to use. Okay? So yeah.
Okay,
I
thank you so
like
much.
Doc, I like what you said to say in the sense that PPARS is very, very powerful and critical portion of cancer treatment, especially if you want to go natural and even more so if you're going for chemotherapy. But again, I just want to say that the fight for cancer is combination of the best protocols and practices. All right. So don't be don't just think, oh, I eat vitamin C, I'm okay. Or if I just take Simply Nature extract liquid, I'm okay. Yes, it does wonders and it gives you very good results. but you got to make other changes as well, lifestyle changes. If you can avail physical therapies like IVs with Dr. Jansen, go ahead. If your uncle or your surgeon prescribes surgery and chemotherapy, immunotherapy, targeted therapy, all this. The good news is that the PPA protocols works with all these different procedures. So again, cancer is not one magic bullet. The more bullets you have in your rifle, the more successful you will be in your fight against cancer. Yeah, Jen?
There we have it. Now, Mom Mary Jane Ramos got curious. She's asking, just to make sure I can avail PPARS through Shopee and Lazada.
Yes, you can.
And we're legit. Yun. So
Go
stay
for
tuned.
the legit last mall, right? We are the only ones. Yeah, it's our actual company store.
Yes. So, Mom Mary Jane, I have a special good news for you. Stay tuned at the end of the webinar.
Okay.
And actually, we're almost at the end of the webinar. This will be our last two questions for tonight. One from Miss okay. Sorry. Okay. Naomi Alona Veras. How about if there is unbalance, no control of left leg? What could be the possible indication?
Oh, I don't know. I have to talk to you. Unbalanced control, or you cannot control your left leg. It can be stroke, it can be injury, trauma, it can be arthritis. Yeah, yeah, I have to talk to you to know for sure, no? Yeah. Difficult to answer your question without taking your history.
Oh. So for those of you who wish to have a consult with Dr. Jansen Calalan, the link to schedule an appointment is in the description box and comment section below. Our pretty healthcare specialists, Miss Beth and Miss Irish, will reach out to you shortly. Okay, next question from Miss Lagrosmi Tarasbales again. Already done mastectomy, and is there a possibility for recurrence of cancer cell? How to avoid such recurrence?
That's it. That is where I come in. So
Yeah.
how can you reduce recurrence after mastectomy? Of course, if it is indicated, you have to undergo the things that your oncologist advise. No, if they advise radiation, go for the radiation therapy. If they advise chemo, targeted therapy, or whatever, no, you have to undergo such things. As for myself, what do I usually prescribe my patients who are already at this stage in their treatment journey? I usually give a pulse and press protocol. So a press protocol is addressing your body. It makes your body hostile to cancer. Okay, it's basically also making your body healthier. So that is where diet, nutrition, lifestyle change comes in. So eat healthy, exercising, sleeping better. I also use a lot of antioxidants, anti-inflammatory supplements that increases immune function. Okay, I'll mention a few, but I have a whole list of them. I think they are 12 all in all, or 10 all in all, but I'll just mention a few of those supplements that you can readily buy at Healthy Options or at your local drugstore. Okay, or now. Okay, so of course, one is Simply Nature PPARS. No, you have to have a microalgae supplement, which I have mentioned already. Why? Number two would be vitamin D3. Vitamin D3 modulates your immune system really well. It reduces inflammation. It reduces recurrence of cancer. It increases your overall survival, basically. Your lifespan, no, after getting diagnosed with cancer. Another one is melatonin. Melatonin is a hormone that our brain secretes naturally to induce sleep. It is an antioxidant. It also has influence over cancer. It increases your overall survival likewise. Okay, so melatonin. Another one would be omega-3 fatty acids. For omega-3 fatty acids, PPARS already has them. However, if you want to take a higher concentration, a separate one, it's okay. I usually use either algae omega-3s or fish oil. For fish oils, no, for those of you who just wants to buy fish oil from your local store or SNR for that matter, you have to take 4 grams of fish oil every day. If 4 grams is too much for you, you have to buy SPM. SPM is a high concentration fish oil. Okay? One soft gel of SPM is equivalent to 4 soft gels of fish oil. Okay? What else? Yeah, those are the ones that I'm going to mention, the supplements. No, there are also, I use also medications that we use for metabolic problems like metformin, atorvastatin. I use them as an for off-label purposes. No, I use them for cancer as well. So the role of these medications is to starve the cancer of fuel. Okay, so that is the PRESS protocol. We have the PULSE protocol. So the PULSE protocol is similar to your chemo, your radiation, wherein we give them in periods, in pulses. So I use medications like ivermectin and mebendazole to stop the cancer from spreading. These are anti-parasitic medications that I use for that I use for cancer, no, as an off-label use. Okay, so the supplements that I have mentioned, like yung vitamin D3, the melatonin, the ivermectin, mebendazole, these can also kill cancer stem cells. Cancer stem cells are also one of the reasons why we see recurrences. And studies have shown that cancer stem cells can reside inside the bone marrow, which is very difficult to reach. Okay, you have to undergo actually chemotherapies to eradicate, no, to reach them as well. The thing is, not all chemotherapy, radiation therapy can kill cancer stem cells because cancer stem cells are dormant. They are not actively dividing. And chemotherapy, radiation therapy can only kill, especially chemo, no, they can kill cells that are in the actively dividing. Those are in the cell division phase. Okay. Yeah, another pulse therapy that I use is high dose intravenous vitamin C. High dose intravenous vitamin C can shrink tumors similar to chemo, slower at that. It can also kill cancer stem cells. Okay. Ozone therapy, I also use that. So ozone therapy, I saw a question by Miss Lucy, what ozone therapy is. So
Yeah.
ozone, yeah, ozone therapy is basically giving the patient an ozone oxygen mixture. So it's a gas. No, so the oxygen there is medical grade oxygen. Okay, the ozone there is just micrograms in concentration, and give we don't give too high of a concentration where we reach toxicities, because ozone, if you inhale that, it is toxic to the lungs. You will cough and cough and cough. It can induce pulmonary fibrosis. Okay, so ozone therapy has to be administered properly. All right, this is medical grade ozone therapy. So the role of ozone therapy is you get 3 benefits, no, for patients. It can modulate your immune system. It can increase antioxidant capacity. It can be used as a germicidal. So it can destroy viruses, fungus, and bacteria. Okay. Another role of ozone therapy, it can increase the efficacy of other treatments. So one such treatment would be chemotherapy, radiation therapy, high dose vitamin C. Ozone therapy really works well with these 3 procedures. Okay, so that's basically what I do for patients. So yeah, that's basically what you will expect now when you go for a consult with me.
Yun, and it looks like we've covered all our questions. Oh, I'd like to acknowledge the presence of Azores de Castro, Natural Healthcare and Wellness
Dr.
Center.
Joy.
Yes, Dr. Joy. So if you guys are nearby Quezon province, you can also consult with Dr. Joy. She's one of our PPARS partner doctor. Yeah. Okay, and as we wrap up this evening, we'd love to hear your final thoughts for our viewers.
No, Jansen, you go first today.
Okay.
Yeah, okay. So I just want to thank all of our viewers for keeping this webinar alive.
Yes.
The questions are wonderful, really. I have said this a few webinars back, though, but we always get new questions. Although all we're talking about is cancer, but we always do get new questions, no? And all of them are quite interesting. Very good questions at that, no? So for those of you who patients who are where you are in that situation wherein it's already quite frustrating, you do not know what to do. Perhaps this can be a sign from the Lord that there is an answer, no, to your predicament. So let's see what we can do for you. Yeah, just go for the just set up a schedule, go for a consult, and we'll see what we can do for you. Okay. There's always something that we can do. Even if it's not curative, there's always something we can do that that can increase your quality of life, even if just by a little bit. Okay. So I'll give the floor to Shyan.
I want to thank everybody like Dr. Jansen. It's been 3 years that we've been doing it. One thing I want to share with everyone is that the things that we have said 3 years ago, you know, along the way, we've added to our understanding. We've also changed some of our protocols. So I want to let you know that the things that we share on this program is dynamic. Dr. Jansen and I are always keeping our eyes on the development in the medical industry and what are the best options available for you. So we are also learning, and this is a ever dynamic program. As you can see, we answer questions from all different angles. And I hope that this has been useful to you. Please share with your friends and family members, especially those who are fighting cancer or any other ailments, right? So see you guys next week, same time, same place. I'll hand the time back to Jhen right now.
Yes, sir, because you're getting my script there. Okay, thank you for participating in today's seminar. Cervical cancer is a challenging journey, but with the right knowledge, support, and resources, it's a battle that it can be fought with strength and resilience. We hope you leave today feeling more empowered and equipped. And we hope to see you again in our future webinars to come. Same day, same time, same place. Every Thursday night at 7:30 p.m. here on Facebook Live and simulcast in YouTube. So next week is for the women again. We'll discuss the many phases of breast cancer. But before that, are you still listening, Ma'am Mary Jane Ramos? Okay. Watch out for Sulit Sweldo sale on our official Lazada mall from September 28th, Saturday, until October 2, Wednesday. So please reach out to your assigned health advisor. And she actually, those of our patients who are already talking to the health advisors, we have 10 pieces of Lazada 60 pesos voucher for grabs. So chat your respective CSOs now. Okay. And if you'd like more information on how Simply Nature PPARS can be a part of your healing journey, please don't hesitate to reach out and stay strong, stay positive, and remember that you are not alone in this fight. So thank you once again for watching Simply Nature webinar powered by SMG or Simply Healed Medical Group. Because your curiosity about your health condition and your victory over cancer and metabolic illnesses is what keeps us going. Here in Simply Nature, we're always with you from start to healing.
Today with a Simply Nature Power Pack, a 5-day combo pack of Simply Nature PPARS tablet for immune boosting and Simply Nature Cleansing Plus for effective detoxification. Now is the best time to try our Simply Nature products. Available on our official Shopee, Lazada flagship store, our website www.simplynature.asia, and our office in BGC Taguig. Order yours today. Click the link on the description box.
These These are the important questions. Do I need to go for chemotherapy? How many sessions of chemotherapy do I need? What about immunotherapy? What about surgery? What about CT scans? Well, join us on our Simply Healed program every Thursday nights at 7:30 p.m. Singapore, Hong Kong, and Philippine time. Our sessions are interactive, featuring a live Q&A with experts and doctors who will answer your questions in real time. You can type in your questions and get immediate, personalized responses. This is your chance to take control of your health. So take advantage of this informative and supportive experience. Visit our Facebook page and message us on Messenger to find out more. See you there this Thursday.
One reason why I recommended initially PPARS is because it can induce lung cancer cell death. The main reason why I tried PPARS liquid, and it did well for the patient. It helped with the tumors. The enlarged abdominopelvic lymph nodes were not detected. This was gone. So that was something that I was actually quite surprised. A 12-centimeter tumor disappearing.
Everybody turn to your neighbor and say, do more. Right? Don't just think there is no one product that will cure you of cancer. Okay, that is like it's like a scammer trying to sell you something. All right, it is a comprehensive approach. When you need surgery, do the surgery, but prepare for the surgery so that you recover well, right? And then if you need to do chemotherapy, radiation therapy, do it. So this is where PPARS really comes in. It's a gene activator, so it's a signaling pathway. It switches on your pathways, your systems. Then the other nourishment that you take will be properly used. Is it easy to understand now?
Now let's not keep you waiting. We are now officially opening the AMA or Ask Me Anything portion.
So she has to take maybe just the capsule or the powder just to regulate blood sugar, and then undergo the surgery. And after the surgery, to aid in wound healing also and for recovery, she can continue the capsule.
I can safely say this, all LJ products are great. But if you have acute illnesses like cancer, then we are a world of a difference. Because if you want chlorella, take chlorella. If you want spirulina, take spirulina. When you take Simply Nature PPARS, you're taking our microalgae for its PPAR agonist.
We are always with you from start to healing.